Hello everyone, welcome to ANAT AV. This video provides a brief insight into the structural composition and osteology of the face. First, we will take a look at the bony arrangement of the face. The bony arrangement of the face comprises of, more superiorly, the frontal bone forming the forehead. Its upper part is smooth and convex, but the lower part is irregular and is interrupted by the orbits and by the anterior bony aperture of the nose. Then, if we move a bit superiorly, we can observe right and left nasal bones forming the nasal bridge. Here are the zygomatic bones forming the bony prominence on the superolateral part of the cheek. And afterwards, if we shift our focus inferiorly, we can see the right and the left maxillae forming the upper jaw.
The face can be studied under 5 major topics. The first region is the frontal region, which presents several features: the superciliary arch, the glabella, and the nasion. The second most prominent feature are the orbits. Each orbital opening is quadrangular in shape and is bounded by the supraorbital margin formed by the frontal bone. At the junction of its lateral 2/3 and its medial 1/3, it presents the supraorbital notch or foramen. The infraorbital margin is formed by the zygomatic bone laterally and the maxilla medially. The medial orbital margin is ill-defined. It is formed by the frontal bone above and by the lacrimal crest of the frontal process of the maxilla below. The lateral orbital margin is formed mostly by the frontal process of the zygomatic bone, but is completed above by the zygomatic process of the frontal bone. The third region that I would like to draw attention to is the anterior bony aperture of the nose. This is pear-shaped, being wider below and narrower above. It is bounded above by the lower border of the nasal bones, below by the nasal notch of the body of the maxilla on either side. Finally, let's concentrate on the rest of the bony structure of the face. The nasal bone is articulated anteriorly with the opposite bone at the internasal suture, posteriorly with the frontal process of the maxilla, superiorly with the frontal bone at the frontonasal suture, and inferiorly the upper nasal cartilage is attached to it.
The maxillary bone contributes a large share in the formation of facial skeleton. The anterior surface of the body of the maxilla presents the anterior nasal spine, the infraorbital foramen, which is about 1 cm below the infraorbital margin. The incisive fossa is situated above the incisor teeth. Then, the zygomatic bone forms the prominence of the cheek, and the zygomaticofacial foramen is seen on its surface. At last, the mandible forms the lower jaw. The upper border or alveolar arc lodges the lower teeth. The lower border or base is rounded. The middle point of the base is called the mental point or nasion. The anterior surface of the body of the mandible presents the symphysis mentae, the mental protuberance, and the mental tubercles anteriorly. The mental foramen below the interval between the two premolar teeth transmits the mental nerve and the vessels. The oblique line running upwards and backwards from the mental tubercle to the anterior border of the ramus of the mandible is present. Now, let's move on to several important foramina present on the face and the structures that pass through them. The supraorbital notch or foramen transmits the supraorbital nerve and its vessels. The infraorbital foramen transmits the infraorbital nerve and vessels. The zygomaticofacial foramen transmits the nerve of the same name, which is a branch of the maxillary nerve. The mental foramen on the mandible transmits the mental nerve and its vessels. That brings us to the end of this video on the osteology of the face. If you enjoyed this video and found it helpful, don't forget to like, comment and subscribe. Please share this with your friends and anyone interested in studying anatomy. Thank you for watching ANAT AV.